Good afternoon. My name is Bruce Wiley, a professor at CUNY, executive director of PHICOR, and senior contributor for Forbes. And since 2017, I've been an advisor to the Project Play 2024 Roundtable. You've heard about how sports matters to individual children, families, schools, and communities. Let's go even broader and discuss why sports matters to our country. And when we talk about our country, let's talk about two big things that matter: public health and our economy. Without good health, our country is limited in what we can do and what we can accomplish. Our country has been facing a worsening obesity epidemic, a growing rate of chronic medical conditions such as diabetes, heart disease, and stroke, and increasing mental health challenges such as feelings of loneliness, depression, and anxiety since the 1980s. At the same time, healthcare costs have continued to skyrocket, approaching 20% of the GDP, up from 5% in 1980 or 1960. Guess who has to pay for these costs? Anyone who pays taxes and anyone who pays for health insurance. Moreover, even though the stock market has done well over the past decade, there have been continuing concerns about declines in economic productivity on a per capita basis, such as costs, and the economy really affects everyone. So therefore, it's not too surprising that, quote, increase the proportion of children and adolescents who play sports, end quote, is one of the goals of Healthy People 2030. What is Healthy People 2030? Well, before each decade, the federal government identifies the biggest public health priorities for the United States and sets goals to achieve them. So one of the goals is to increase the proportion of youth who play sports from the 50.7% level in 2020 to 2021, which is the most recent year with available data, up to 63.3% by 2030. Unfortunately, thanks largely to the COVID-19 pandemic, the number has been going in the wrong direction. So this percentage has actually fallen from the 58.4% in 2016 to 2017, which was the number that was set as the baseline for Healthy People 2030. So what could achieving that goal really give our nation? Well, at the request of the Aspen Institute and the President's Council on Sports, Fitness, and Nutrition, we at PHICOR fired up our computers and used VPOP, which is our virtual population computer simulation model of youth ages 6 to 17 in the United States. So think of this as SimCity for the entire United States, full of virtual people behaving like real people. You know, like real people, these virtual people can choose to do different things each day, ranging from just sitting around to playing different sports. So each of these virtual youth have virtual biological systems inside them, just like metabolic systems, muscle, fat, just like a real person, just like real youth. And these systems can change over time depending on what they virtually eat and how much physical activity they can get each day. And as we simulate through time, these virtual people can develop different medical conditions, such as just like real people. And they have to go see the doctor, go to the hospital, and they can even suffer earlier deaths. All of these things can end up costing lots of money. So let's imagine a population where 63.3% of youth people participate in sports, in line with the Healthy People 2030 goal. How would that population be different from today's reality, in which barely half of the kids are playing sports? We ran that simulation for the entire lives of this cohort of kids, and here's what we found. First of all, the prevalence of overweightness and obesity drops 4.2%. That means averting approximately 2.3 million children and adolescents from being in the overweight or obesity category. Then over time, here's how many cases of diabetes, heart attacks, cancer, et cetera, that can be prevented. More than 500,000 of these cases. Preventing all of these could save lots of medical costs, lots of costs. In direct medical costs alone, the economy would save $23.8 billion. And remember, who pays for these medical costs? Not just the people who suffer these medical problems, but all of us. Anyone who pays taxes or for health insurance. Then there are the following gains in productivity. Another $32.8 billion generated for the economy through increased worker productivity. Just these numbers alone are bigger than the amount of money that parents spend annually on youth sports today for the kids who do play. That could be a real boost to the economy in general. Who wouldn't want that? So perhaps most importantly, more people we love would live better lives. We project that 1.4 million quality years of life would be saved if youth sports participation moved to 63%. And again, that's a conservative estimate. So did you know that people with healthy habits, including physical activity, of course, are 60% less likely to suffer from Alzheimer's disease? Or that people who are physically active during the pandemic were less likely to suffer and die from COVID-19? The US isn't the only country that needs to get more people moving. Our entire world is in the midst of an obesity epidemic and continuing rises of chronic medical conditions like cardiovascular disease, diabetes, et cetera. Everything from a shortage of healthcare workers to shortages of military recruits are being affected by these chronic medical conditions. In fact, the World Health Organization, the WHO, has called non-communicable diseases the world's biggest killer.